Herpes is a viral, sexually transmitted infection that once you have that virus in your body, it creates these sores that come and go. And it's, basically something that you'll have forever. There's no cure for herpes. And a lot of the treatment is aimed at just pain management, kind of taking care of those sores, making sure that you don't get any other infections, or and educating that once you have those sores, you don't want to go out and pass that around. We also want to make sure that you're using safe sex, and doing what you can to make sure that you don't pass that on to anyone else. So it can affect your mouth, your vaginal area, and your anal area.
Okay, the STD we're going to talk about now is HPV, and like herpes, it's a viral STD, which means that once you have it, it's yours for life. There's no getting rid of it. Some of the risk factors are just like the rest of them: having multiple sexual partners, having unprotected sex, and not getting tested. So with HPV, the thing is that you can go a long period of time without even knowing you have it. So you can pass it on to other people before you even know you have it yourself. And you can transmit this by having vaginal sex, oral sex, or anal sex. If left untreated, it can actually lead to cancer, which could ultimately end up in your demise or end up in death. You also, grow warts that can come around your anal, vaginal, or mouth, or even the back of your throat. And the only way to get rid of these warts is to either have them burnt off, or cut out, or dug out, as they say. As far as treatment, that's really the only thing you can do. There's no treatment. Once you have it, you have it for the remainder of your life.
So next we're going to talk about chlamydia, and it's one of the most common bacterial forms of an STD. And since it is bacterial, you are able to treat it, thankfully. So a risk factor for it is just having new or a lot of sexual partners, having a history of an STI, and also not using a condom correctly, which it should be latex. Next, the signs and symptoms. 75% of women and 50% of men are asymptomatic, so half the time you don't even know you have it. If you do have some symptoms, it might just be painful urination. And for transmission, it could be vaginal, anal, oral, and if you're pregnant and have a baby, it could be given to your newborn baby that way too. Diagnosis is pretty easy. You could just get a culture, or even just something simple like a urine swab. And if left untreated, for men and women, it could lead to infertility, and treatment is just something simple as an antibiotic.
Alright, so next we're going to be talking about gonorrhea. Gonorrhea is a bacterial STD, and it can be treated with antibiotics. It is treatable. Your risk factors for it are having unprotected sex, multiple sexual partners, and having sex at a young age. The signs and symptoms are burning with urination, discharge. You can have swollen testicles. It is transmitted via vaginal, anal, or oral sex. If left untreated, it can cause infertility in both male and female. And in female, you can get pelvic inflammatory disease. Just to diagnose it, you just need a swab or urine culture. And then for treatment, it is treated with antibiotics, and after getting treatment, you need to abstain from any sexual intercourse for at least 7 days.
So some key points we really want y'all to take away from this is the only way to really prevent any of these STDs is to practice abstinent, which means not having oral, vaginal, or anal sex. Or if you are going to participate in sexual activities, to make sure you use condoms, use protection, practice safe sex. Make sure you talk with your partner. If you know you have a STD, make sure you let them know that you have it. That way y'all can be careful and keep both y'all safe. Using birth control, getting medical treatment to prevent or cure STDs, or the STDs that are curable. Be sure to wash before and after sexual intercourse, and limit the number of sexual partners you have. If you do suspect you have an STD, some of the places that you can go to get checked or your local Planned Parenthood. You can go to the Public Health District, or you can go to CareNet Pregnancy Center. And just remember, you always want to protect your wand from Hogwarts when entering a Chamber of Secrets. I'm Harry Potter, and I approve this message.